Welcome back, everybody. And just a reminder, we are recording, so then we will post the link on the website for anybody that wants to rewatch and get the information again. Or if you just want to share it with other people, it will still be there. So I'd like to welcome you all for attending. It's a wee bit smoky here in Kamloops, and I want to welcome my colleague and friend who's our guest speaker today, Elizabeth Klarenbeek. Today's topic is being lung healthy, cold and flu season. So this is the subject matter she'll be talking about. Just a reminder, we will be having next month's webinar, which will be, I believe, November 24th. And we'll be talking about nutrition for COPD. So just a reminder to register for that next month's series. And if you have any questions today, please refrain from asking them unless Liz, I'm not sure if she has time built in for questions. If she does, then feel free. Otherwise, put them in the chat box and then we will address the questions at the end of her presentation. So a little bit about Elizabeth. I think she prefers to be called Liz, so we'll go with that. So she's a good friend of mine. She's also a colleague of mine here at Thompson Rivers University. She is an assistant teaching professor in the respiratory therapy program. And she's been an RT for about 9 years, graduating from the same program here. She worked up in Prince George for many years. I believe it was 5 or 6 years as an acute care RT and as an educator to her colleagues up there. She has come back home to us in Kamloops, where she joined us at the local hospital and has begun teaching this past fall with myself as well. And she is lucky girl in school as well, completing her Master of Education. And she's a mom of 2 beautiful little people, and she loves spending time with them, her husband. He's second, not as important, the dog, and she likes to go camping. So I would like to say thank you so much, Liz, for coming in today and talking, and I will hand it over to you.
Hi, everybody. I'm really excited to be able to join with you guys today. I'm going to share my screen. Give me just a minute here to make sure that I can do this appropriately and get the right screen up for you guys.
I'll let you know, Liz, if it works. Okay, so switch your view. Yeah.
And okay. Do you see the presenter view with that, or
I see yours?
You see mine? Okay.
Yeah. I know I always forget how to do this. I would just end show.
There we go.
There we go.
That? Perfect.
Yeah.
I knew there was a button. Figured it out. Okay, hi everybody and welcome. I'm going to be talking about cold and flu season, which is coming upon us imminently right now. And thank you, Lindsay, for such a nice introduction. If I'm going too fast, flag in the chat and I can slow down. Sometimes I speak a little fast when I'm doing something new for myself. But today we're going to go over the differences between cold and flu, how we can treat these viruses that we get in our winter season, and different prevention strategies you can use to try and avoid getting them. So when we talk about cold and flu, we're talking about 2 viruses. And we have to remember when we're talking about viruses that these are different from our bacterial infections that we can get. And viruses, we can't treat viruses with antibiotics like we do with our bacterial infections. So what we want to be able to remember is that both cold and flu are respiratory illnesses, and they present with very similar symptoms. So sometimes it's hard for you to know what is making you sick, whether it's flu or whether it's a cold. So I'm going to go through a little bit of each to show you the differences between the 2, both of these viruses. So talking about colds, they're contagious respiratory illness, and they're caused by a virus called the rhinovirus. And just a fun little fact, rhino I forgot to put whether it's Greek or Latin, but from either one of those languages, it actually means nose. So it reminds us that our cold is kind of in our face typically. Colds are milder than the flu, and they're they're characterized by that rundown feeling, a scratchy throat, those watery eyes, and a runny nose, and you can get pretty sneezy. But they're milder than the flu, and they typically go away on their own. And we manage these cold viruses with fluids and rest, and you can use warm saltwater gargles to help if you're feeling congested. And if we're taking medications, over-the-counter medications, we typically take them for symptom relief. They're not going to kill the virus, but they may make you feel better by making your symptoms be lessened or go away. Colds typically run between a week and 2 weeks, and they don't result in serious health problems. They don't result in a pneumonia or any sort of bacterial infections, and they don't cause any sort of hospitalizations. And when we look at flu is also a contagious respiratory illness, and it's caused by an influenza virus. So there's two main human flu viruses. There's a type A and a type B. And these two viruses are responsible for our yearly flu epidemics that we see. So our seasonal flu. And they can cause either a mild illness or a severe illness at times, and they can even lead to death, depending on how serious of an infection you have. And flu viruses are funny little buggers. They like to mutate, and they mutate all the time. So every year we get these different variations of these types of flu. And what that means is that our bodies have to learn how to adapt each year to these new variants. And the vaccine that's provided to us is researched and worked on by medical labs around the country to predict what flu is going to be affecting us in the year to come, and they're built around that. So that's why we get these yearly flu vaccines and not just a lifetime vaccine for flu. Because it's highly mutable or mutatable, we need to kind of play catch up with it each year with our vaccines. So when we have a flu, we have, sorry, I had a little like reverb of my microphone speaking back to me, so I could only hear myself. With our flu symptoms, we can have all or just some of the following that I have on this list. So sometimes you'll have a fever, a cough, a sore throat. Your nose might be stuffed up or runny. You're pretty achy. Your muscles are achy. You might have a headache. You're going to feel tired. Sometimes you may have vomiting and diarrhea, but this is typically more common in children. And just a note about the fever and flu, if you are immunosuppressed or immunocompromised, so your immune system isn't functioning very well, you may not have a fever, but you may still have the flu virus. So I popped this slide in. It's from the CDC in the States, but it gives a nice little comparison of those symptoms we were talking about and the difference between cold and flu, because a lot of those symptoms overlap, and some are present and some aren't, and it's always hard to remember. So I always like a little chart that can remind us of what the difference is, whether we've got a cold or a flu and how we're feeling. So this link will be made available in the chat from Lindsay, so you can have it as a little easy go-to on symptoms if you're unsure of if you've got a cold or a flu. So moving on, we're going to talk about how flu spreads, how we end up getting the flu from other people. So flu likes to spread in tiny droplets of fluid from infected individuals. And we make these droplets when we cough or sneeze, or as our Prime Minister liked to discuss at the beginning of COVID, talk moistly at you. So any sort of droplets, aerosolized droplets that we create can pass a virus on to somebody else. And these droplets land in your mouth or nose, and we can breathe them in, and that's how we end up getting these viruses from other people. And that 6 feet difference is the same whether it's COVID or flu. These droplets can fly pretty far. Flu can also be spread by touching contaminated surfaces. So if somebody has touched their mouth or nose and then grossly wiped it on a table and you go and touch it and touch your face, it can, although it's less common, you can still potentially get the flu virus from that. So a little fun and or gross fact, depending, is we touch our face about 16 times an hour, and I would say that might be an underestimated number of what we actually do. So every time you touch your nose or face, there is potential of spreading germs. So just keeping that in mind, especially during flu season, your hands, you want to have them nice and clean so we can touch our face like I'm gonna now because I've been talking about it. So for flu, there is a period of how contagious we are and its ability to spread. So the period of contagiousness for flu begins 1 day prior to the onset of symptoms. So you may not even know you have the flu and you're still contagious. And you're contagious through to about 5 or 7 days after becoming sick. And that the most contagious period is at that 3 to 4 days into your illness. Again, for people with weakened immune systems, young children, or immunocompromised people, they can actually be contagious longer than the 7 days and infect others for an even longer time. So flu season, we typically see seasonal flu in fall and winter months. However, it does occur year-round. And the increase in our activity usually begins in October and carries on to May. And we see kind of peak activity between December and February. And flu likes the winter months or the colder months because it is more stable as a virus in the cold air and in that low humidity levels, in that cold, dry air we have to breathe. And it allows the flu to hang out in the air for longer periods of time. And combined with that fact that it'll hang out in that dry air that's around, we also spend a lot more time indoors when it's cold outside and you're in closer contact with people, and that just mitigates that ease for the virus to spread. So with flu, we talked about how it is a more serious virus than a cold virus, and flu can have some complications. And some of these complications are bacterial pneumonia, ear infections, sinus infections, and it can worsen these chronic medical conditions that you may have or may know people who have them. So CHF, so congestive heart failure, COPD, asthma, or diabetes can all be worsened if you have the flu virus. With the bacterial pneumonia, our body is trying to fight off the flu when we have it, and it makes our bodies more susceptible to other infections from other sources like a bacteria. And I'll touch a little bit more on this when I talk about the pneumococcal vaccine that's available. Ear infections and sinus infections, when we have the flu, we have a buildup of fluid in our ears and in our sinuses. And this buildup of fluid actually allows bacteria to grow really well. And this can cause that sinus infection or ear infection. And with the worsening of our chronic medical conditions, your body is feeling stressed from the flu virus and it's using energy to try and get rid of it. and your body's mounting this big inflammatory response. And this, the chemicals that are created when our bodies have this response can exacerbate any of our medical conditions that we have or worsen them. So who's at risk of the flu? Oh, there we go. Got it. Anyone can get the flu, even healthy people, and you can get serious problems related to flu, whether you're healthy or have a chronic condition or any age group. Everybody is at risk for serious problems, but you are at higher risk of developing complications, or certain groups are at a higher risk of developing complications associated with flu. So these groups of people that are at risk are people who are greater than 65 years old, you have a chronic medical condition, pregnant women are more susceptible, young children. If you live in a group home or a nursing home or long-term care facilities, and you're more susceptible to high-risk complications, if you have overcrowded living conditions, or if there's any barriers to accessing healthcare. So there's a whole list of chronic medical conditions that are associated with a higher risk of complications with flu. And some of those include cancer or anything that's immune compromising, diabetes, heart disease, lung disease, so including both COPD and asthma, anemia, obesity, kidney disease, and any neurological or neurodevelopmental conditions. So it's these high risk complications are the ones we just talked about, and just being aware that we want to protect ourselves the best we can from flu, especially if we are at a higher risk of these complications. So treating both colds and flu, I talked a little bit about treating colds, and we can treat flu in similar ways. Our over-the-counter medications that we get from the pharmacy are there to treat symptoms. They're not there to kill the virus. They are there just to help ease your symptoms, make you feel a little bit better than how crappy you might be feeling at the time. A tip to remember is you want to use one type of drug to address each symptom. So an example would be if you are taking a cough syrup and it has a pain reliever in it, you don't want to take a pill that has a different pain reliever in it. So you want to be aware of what medications you're taking and what's incorporated in those medications, because some of those medications that we can get, like Dayquil, are able to treat multiple symptoms. So you want to, if say you are taking the Dayquil and it's treating these multiple symptoms, it's best to stick with that medication throughout the course of your flu, so that you're not kind of mixing and adding in extras of these different types of medications. So looking more, these over-the-counter medications, these symptom relief medications, you can take them with all of the home remedies that you have. So that nice warm soup, it's soup season, which is my favorite. Tea with honey to help your sore throat, or gargling that warm water to help with your sinuses and your sore throat. They can be taken with all of those. Vitamins and herbal supplements like echinacea or vitamin C or zinc supplements, there's been no research to prove that they're effective in preventing or treating cold and flu. That being said, if you found they work for you, that is completely fine. Some things work for others, and the research isn't there to say they are effective. It doesn't mean that they're not. It's just there's no research to back that evidence. Serious flu, if you are getting really serious flu and you're at high risk of complications, it can be treated with an antiviral medication. So just like an antibiotic, antivirals work at eliminating viruses, where antibiotics work at eliminating bacterial bacteria. So an example of this is Tamiflu, and you may have had this if you've had the flu in the past. It does require a prescription from the doctor, and it has to be taken within that kind of beginning days of you getting the flu to be effective. So I wanted to touch on a couple of respiratory techniques that you can use if you are experiencing that shortness of breath or uncomfortable, or that shortness of breath or that really thick, tenacious mucus that you may get with flu. So remembering our pursed lip breathing, so a big breath in and a blowing out the birthday candles, nice and slow out, just to get a hold of that shortness of breath, try and help mitigate it. If you are taking Ventolin as your rescue inhaler, if you are getting sick, it is okay to increase the number of times you're taking it while you're sick. And if you are feeling sick, it may be something to discuss with your doctor about increasing the use of your inhaled steroid puffer if you've been using one. Sometimes that can help with the inflammation that's created by these viruses and help that shortness of breath. But again, increasing your steroid dose is something you want to talk to your doctor about before increasing it. For mucus, that really thick mucus, a huff cough can be really effective at moving that thick stuff up out of your lungs. So that cough, and also increase the amount of fluids you're drinking. So staying hydrated actually thins out your mucus secretions in your lungs, and that makes it easier for you to cough them out. All right, so flu vaccines, they're available yearly, and flu shots are there, and they're there to protect against 4 influenza viruses. So these 4 influenza viruses are those ones that the research has predicted are going to be the most common in the upcoming seasons, and it's typically these mixtures of A's and B's all mingled together when they decide what they think it's going to cause our flu season this year. Most of our flu shots are with a needle in your arm. There is flu vaccine nasal spray. Typically they save this for children, just who are it's a little easier to give that to little kids more so than adults. When we give flu vaccines to individuals greater than 65 years of age, they should be getting an inactivated flu vaccine. So there's 2, there's Fluozone and Fluad. And the reason that we give this inactivated flu vaccine is it's just a little bit safer than the attenuated ones. They're all safe. There's no unsafe vaccines, but this is just giving you a little piece of the virus to show your body what the virus looks like, so your body can get ready to have a proper immune response if you're exposed to that flu virus. I just want to reiterate, you cannot get the flu from the flu shot. It doesn't give you the flu. It may give you flu-like symptoms, and that's your body building that immune response. Your body should have some reaction to that flu shot. That's okay. It's not fun. Nobody likes feeling crappy after they get their vaccine, but it's helping your body recognize that virus. So when you're exposed to it the next time, it's ready to fight it, and you may get really mild symptoms or no symptoms at all. Additional information for you about vaccines. So I wanted to touch on the pneumococcal vaccine, and it's a vaccine that's provided in these winter months as well. And it's there to protect you from a pneumococcal infection, which is actually a bacterial infection from a strep pneumonia bacteria. And getting this vaccine along with your flu vaccine can just really protect you from those serious flu complications that you may be more prone to if you're part of that high risk group. The Streptococcus pneumonia bacteria is very serious and it's life-threatening. It can cause meningitis, so inflammation of the lining of your brain. It can cause sepsis, so blood infections. It can cause pneumonia, so infections in our lungs. And it's spread just the same as flu spread and things like that. So remembering, if we are sick from flu, our immune system is down and working hard to get rid of flu, and it's making us more susceptible to these bacterial pneumonias. So having this pneumococcal vaccine just offers that kind of double protection against these bacteria, against this bacteria, to protect ourselves so that we don't get really, really sick. So how can we prevent cold and flu? I mean, we've been talking about germ protection for quite a few years now. So preventing the spread of colds and the flu, washing our hands, up your washing of hands in the winter especially. You want to keep washing your hands over and over. Anytime you think you've touched something that's might be covered, give them a wash. Always cover your cough, and remember, don't cough into your hands. You want to do the little vampire cough, bring your cloak over, cover your mouth into your elbow there, because as soon as you cough in your hands, you got to go wash your hands. If you're sick, make sure you stay at home. Try not to spread any of the viruses if you can. And we recommend that you get a flu vaccine each year. I explained why we want to get them each year, that the virus is mutating every year. It's a sneaky little one. And flu vaccine has been shown to reduce flu-related illnesses and reduce those serious flu complications that can result in hospitalization or death. So remembering that you may still get the flu if you get the flu vaccine, but the chances of it being mild flu is very great compared to if you didn't have the vaccine. So it's similar to the COVID vaccines that are out. It may not stop you from getting flu, but it'll make it a lot milder if you've gotten the vaccine. And they recommend everybody 6 months and older should be getting the flu vaccine. And ideally by the end of October, you want to get your vaccine sooner rather than later, so you're not in those high peak months of flu season. And just to go over hand washing, so you want to keep your hands clean by washing your hands more. It's one of the most important steps to avoid getting sick and spreading germs to other people. So if you're not able to access clean running water, you can use an alcohol-based hand sanitizer, and you want to make sure it's got at least 60% alcohol so that it's able to kill viruses and bacteria that may be on your hands. Another reminder, you may have seen this hand washing diagram before, but it's always good to remember where you're cleaning your hands. You want to make sure, so there's a lot of fancy physiology words in the descriptions there, but you want to put your palms over, it's very weird with my camera. So you put your palms over each other, washing the backs of your hands and interlacing your fingers. You want palm to palm and interlacing your fingers. Get the backs of your hands and those fingernails by interlocking your hands together. And a big one a lot of people miss is washing the thumb. We always forget to wash the thumb. And then again, just making sure you really get those nail beds into your palms of your hands to make sure they're clean. And as we all know, everybody says, sing the happy birthday song twice. It gets a little cumbersome or old because we've sang the happy birthday song so many times. So I don't know if anybody's a Corb Lund fan or anything, but he sings a song that you have to sing 3 times to get the timing, but it's rye whiskey, I cry. If I don't get rye whiskey, I think I may die. So if you repeat that 3 times, then you're good. And you can change it up then. Then it's not so happy birthday every time. And then after you're done, you want to make sure you rinse them under running water and dry them with a clean towel or let them air dry. And after my beautiful song there, that's the end of my talk for you guys. So that if there's any questions, feel free to pop them into the chat or let me know.
Great job, Liz.
Great job.
Thank you.
Do you want to unshare your screen and then we'll start jumping into some questions? We did receive some throughout the presentation.
Okay, good.
And so we might as well hit those up first. And then if it spurs on any questions, then we can take them on. And then I have a couple of questions as well that I wanted to do, and just some points to supplement Liz's great talk. I thought it was phenomenal. The first question comes from Maureen Silver, and I don't know if I see you on the screen, but Maureen, oh, there you are. You can unmute yourself and say hi if you want. Maureen was curious, how often should we be getting the pneumococcal vaccine? Should we be getting boosters?
It does depend on your personal health, on how often it is given. Typically, for adults, I'm just making sure I've got my the amounts right. So typically it is, you can get 1 dose and then I believe 1 booster, and you should be good for your lifetime, but this can change if you've got any sort of immunocompromised disease or processes like that may be causing your immune system to be weakened. So it is something to discuss with your doctor as well, to see what they recommend based on your health history.
Okay, I've got COPD, but I don't have, I'm not immunocompromised, so I've had both the shot and the booster, so I should be okay, right?
Yeah, I believe
Good.
so. Yeah, that sounds right.
Good.
Yeah.
I'm
I have
going
enough
to-
shots.
Yeah, you should be good. I'm going to actually send a link out right now. This is from the Canadian government, and it's just the recommendations for pneumococcal vaccines, because there are different types of vaccines that may have different recommendations based on age, just like Liz said. So I just put that in the chat box for everybody to see. It's a bit of a wordy page, but there is spots where it says booster. So if you've had a certain type of vaccination and you've hit what they recommend, then thumbs up to you.
Just to add on that, some of them, there was some new guidelines that came out that if you're over the age of 65, that every 5 years they may require you. So you definitely want to check in with your family physician, because you may be one of those, depending on your health condition. They may say, you know what, yeah, go for your 5-year booster. So like Liz says, it really depends on your health.
Maureen, does that answer? Did we hit the nail on the head for you?
You sure did. Thank you very much.
We like when we do that. The next question for you, Liz, was, can you get your flu vaccination and your pneumonia vaccination at the same time?
Oh, good question. I
And Alexa
think,
and I can always step
yeah,
in.
if you guys remember, I'm trying to remember, because I know shingles is different. Shingles, you usually have to wait. And I
Yes.
think with the pneumococcal, you can get it with your vaccine. Yeah, you can get it with your flu vaccine at the same time. The shingles one, there's usually a gap depending, but for pneumococcal and flu, you can get them at the same time.
Yeah. And I think it's just preference on how your body responds, right? Because as Liz said, when you get a vaccination, it's either a small amount of a live virus or a small amount of a dead virus to stimulate your immune system to go, hey, I need to build this army to fight off that infection if I ever meet it, right? And so if you do that twice, then you may feel both of those types of symptoms at once and just feel quite cruddy instead of splitting it up. So it's just, however, I get the COVID vaccine and I'm out for 7 days because I feel terrible. So I'm never going to double up on something. So I think that would be what might determine if you want them at the same time. But Alexa or Liz?
It's not unsafe to get them at the same time. You just might feel worse for having both at the same time.
For sure.
Your immune system is going to be really ramped up. So you might want to make sure that your next couple of days are clear. Depending on if it's a long travel for you to come in to get your vaccine, or just how timing works out, sometimes some people, that's all their option is to get them both at the same time. Just make sure that you got some Tylenol to kind of help you with some of those symptoms that may happen.
Perfect. Hopefully that answered the question. I don't know who it was from. It was just sent in from Maureen. The next question we have is, any suggestions for clearing out your sinuses? And do clogged sinuses have any health implications? And this came from Sam Simpson. So if you want to wave and say hi, Sam, or unmute yourself and chat, you are more than welcome. If not, you don't have to, no pressure.
Yeah, so with those sinuses and clearing the sinuses, you may find those warm saltwater gargles may help clear a little bit of the sinuses. If you already use a neti pot or anything that can help clear out your sinuses, that may help relieve some of those congested symptoms. And with those sinus, that buildup of the sinus fluid or the ear fluid, like I said, they can be really easy targets for bacteria to infect that area and cause infections on top of the flu. And those may be bacterial infections, and then you may have to go in and get antibiotics for that infection while you're still fighting off the flu. So anything that you can ease that congestion or that stuffiness, definitely worth doing, just to try and get that fluid moving out of those areas if you can.
And remember, everything's connected, everybody. So if you get a sinus infection up here and you lay down, it's going to drip down to the back of your throat when you're snoozing, and it might drip into your lungs, causing a lung infection. And we don't want that. So if you can treat those, definitely, I would follow that.
The other thing, some questions I know that's been brought up in the past is some people mentioned or have kind of described that the neti pot doesn't seem to work once they have, their sinuses are completely clogged up. You can at the pharmacy get saline sprays, and I find they're more pressurized and they tend to kind of help break things up a bit more. So it's the same. There's a lot of different brands, but there is this, it's usually in the same area that you would find a neti pot or anything, but sometimes the gravity force of using the neti pot just isn't enough to help clog out those sinuses. So you can get the spray, which tends to be a little bit more relieving. And if that doesn't help relieve out your symptoms, because there's typically usually a lot of inflammation, then you can get the over-the-counter medication that has a bit of a steroid in it too.
Perfect. I think that was great. And Sam said, thank you. So I think we answered that question really well amongst all of us. The next question came from Barbara, asking about what information, Liz, do you have on Prevnar 13? So the pneumococcal one.
Oh, I don't have much in the way of information on that specific vaccine.
That's okay. I took a moment to look it up.
Okay.
Help out. It's
Yeah.
okay. The Prevnar 13 vaccine is one that is actually given to children. So at 2, 4, 6, and 12 through 15 months of age, and to older kids that need it. And it protects against 13 types of pneumococcal bacteria, because I believe Alexa or Liz has this number memorized, but there's a whole bunch of different types of bacteria that cause pneumonia. And so not every vaccine is going to protect you against each one. Lex, how many are there?
Well, there are different ones, but I think the Prevnar 13 protects you against 23 strains of
Okay.
that cause bacteria, or 23 strains of viruses that cause pneumonia.
So it is giving you a level of protection, but it's not blocking all of them that you may one day encounter, but it's protecting you against the most common ones, which is important. Did you have any other question that tied into that, Barb?
Just to add on that, the Prevnar 13 can be given in a 2-dose series after the age of 65. I'm not sure if you mentioned that.
No, it wasn't on the
I
page.
was going to say I'm not young anymore, and I did have Prevnar 13, so.
Oh, good.
Yeah.
The
Well, it's
2-dose
good for
series
adults
that are
too,
given
so.
after, it's just going to help because we get that when we're younger, and it will help kind of boost up your immune system again.
Those were all the questions that I had written down. Thank you so much, Barbara. That was a great question. Does anybody else have any questions that they just want to unmute themselves, wave your hand so our eye goes to the screen, and then you can ask away? Oh, somebody's waving at me. Betty. Hi, Betty.
Hi there. I just had a question about what you said about when you have the cold and using NyQuil or whatever medication, stick with that one medicine.
Mhm.
I take like Tylenol and Advil together every 4 hours for arthritis pain. Is that not a good idea to do?
That's fine. And those pain medications do work in different areas and provide different symptom relief and different anti-inflammatory and things like that for your arthritis. For the flu, or when you're treating a cold, it's just better to be cognizant of what your medication that you're taking contains, because a lot of these medications that are on the counters at the pharmacy have multiple symptom relief. They have a whole list right on the front
Yeah.
of what they're going to help you with. So it's just being aware that if you're taking something with a pain medication already in it, you don't need to add on another pain medication on top of that. Throughout, anytime you have a cold or flu, take your regular medications as prescribed, as you're supposed to. And then if you are adding those symptom relief medications, just be aware that you don't need to necessarily increase the amount of pain reliever that you're taking, because there may be a pain relief in that symptom medication, that Dayquil or NyQuil.
Good stuff. Thank you
Mhm.
very much.
You're
Thank you.
welcome.
Thanks, Betty.
That was great.
Anyone else with a question that's burning a hole? No? Okay. So there were just some points that I wanted to tag on because Liz brought up so many important pieces of information. Thank you so much. This was really, really well done. When she was talking about supplements, that there's no proof that they help or that they do anything or they don't do anything. I just want to remind everybody that if you're taking regular medications for your COPD or your heart or anything, any kind of medication that's regular, make sure that it's okay to take whatever supplement you are taking, because it may interact with the medication or it may stop the medication from working effectively. So just make sure it's okay to take both, and you can ask your pharmacist that question. They'll be able to look everything up and tell you yes or no. Okay, so just make sure of that so everybody stays safe.
Awesome.
Yes, sorry.
I think that was Betty.
Betty, did you have something to say?
No,
Oh, okay. I thought I heard somebody talk. So I just wanted to, remind that. And then Liz brought up so many beneficial pieces of information that are covered in our previous webinar. So she talked about knowing kind of what your baseline is and what medication you're taking and when to increase it. So if you refer back to our action plan webinar, it talks about developing your action plan and knowing when your signs and symptoms have changed, so your work of breathing, and what steps your physician or your nurse practitioner or whomever wants you to take in regards to your puffers. So that's your first kind of line of defense. And then she was talking about bronchial hygiene, so the huff cough and staying hydrated. And we have that bronchial hygiene webinar that goes through those steps. So our physiotherapist friend went ahead and helped us out with that. And then just remembering your breathing exercises. So if you do feel short of breath, you can do your pursed lip breathing. And so if you have any questions or want to just refamiliarize yourself with those techniques that she talked about, they're all there in those recordings, and that's on the BC Lung
I'm
Foundation.
just going to post it into the chat right now. This is a link to all of our previous webinars.
Yeah.
And then you can go back and look at any of them to see if you want to review any of the information or if you maybe missed out on something.
Yeah.
We kind of tying in our past presentations into this. So I just kind of post the link right there, and it's a YouTube video.
Thank you. It's like we built on information. Gotcha, guys. Is that all the questions that we had?
That was a great information, perfect timing, and just kind of take away, make sure that, especially if you're over the age of 65, definitely connect with your family physician to see if you're due for any of these additional vaccines to help protect you, especially going into this cold and flu season.
I just want to make a comment about this getting a flu shot by the end of October. When I registered to get the COVID and the flu shot,
Yeah.
like COVID booster.
Mhm.
And I got that right away once I got the message from BC. The earliest date I could get was November 8th. And now you're saying the flu shot, you should get it possibly by the end of October. So I guess,
November 8th isn't too far away. I know the flu vaccines are just kind of hitting the counters, and if you were more comfortable and wanted to get your flu vaccines earlier, it's something you could talk to your pharmacist about, and then you could just get the COVID booster on the 8th. That being said, sometimes there is that delay in how many flu vaccines are going to which pharmacies and things like that. So the end of October is an ideal, and it's not necessary. It does depend on availability across the provinces and everything like that. So the November 8th, that's only 3 weeks away, and then it's kind of a one and done for you. It's just one important appointment to have to go to too, which is always nice to not have to go multiple times. But if you were wanting to get your flu vaccine earlier, you could pop into your pharmacy and see if they're able to get you in.
Mhm.
okay, thanks.
I think the recommendation, by the end of October is to ensure that it gives your body and your immune system enough time to build that level of defense before we truly get into the meat of cold and flu season. So that's, like Liz said, the suggested kind of time.
That, and also just to make sure that you have that immunity built up before the holidays. I think the holidays is when we tend to see a lot more people, there's more gatherings. And that's typically when a lot of that cold and flu season kind of starts ramping up. So ideally by the end of fall is always nice. But again, it's going to be based on availability.
Thank you.
And we've got Kathy with her hand up.
Yeah, hi. I was just wondering how many COVID boosters shots are the maximum number we can get and the ideal we should aim for?
I don't know if there's an answer for that yet.
That's just next year, Kathy. They'll probably increase.
Every
them
time
by
they
2.
text you, just say yes.
Okay, so then okay, at this point in time, what have people had? Like
I think
4?
3 boosters?
Yeah, it depends on, your health status and your age, because to be considered vaccinated, it was just the baseline of 2.
Yeah.
And then you got your 3rd booster, and now a 4th booster that I've seen some people hold up before have gotten based on your health status and your age. And then they just recently came out with a bivalent one, which is supposed to address the 2 new variants, the new mutations that
Okay.
have come out. And
Okay.
so you're supposed to wait. They make you wait in between because you have peak immunity and then it starts to wane. And that's why they're encouraging these boosters. I don't think it's every 6, I think it's every 6 months almost now, but they're going to be coming out with new variations and whatnot. So it is going to change, but if you stay on top of yourself and you're keeping yourself safe, and when you get the message and it says, okay, you're eligible for a new one, then it's a decision between you and your healthcare professional as to if you go and get another one. I have loved ones who are immunocompromised, and my father's 73. And so he will go and get one every single time he's invited to, which is perfect to keep him safe.
Thank you. Thanks all.
Yeah. COVID, how long? Oh, there is a question for Ron, or from Ron. Barely months ago, I'm sorry to hear that you were ill with COVID. How long should you be waiting to get it? It is 6 months from your infection. So because your body has been exposed to one of the infections, you got the infection and now it sounds like you're home, which is wonderful. Your body has mounted that immune response. It's gathered the troops to fight whatever form you were infected with. So it should be about 6 months. I had COVID in June. I will not get another booster until December at the earliest. And I'm glad you're feeling better. And yes, the symptoms of the cough are irritating at best.
Mm-hmm.
Yeah. But glad to hear that you got out of there. For sure. All right, we only have a few minutes left. Last chance for some questions to Liz before she has to go teach the next generation of respiratory therapists.
One thing that with COPD that I have, and that's the emergency treatment in case of infection, and that's prednisone and some other drug, and there was no mention of that.
So that is in, is it Barry that we're speaking with?
Yes.
Wonderful. So if you go back to the webinar about your COPD action plan, it talks about that. So when you start getting ill, you've got this emergency plan in place so that if you do get sick, we want to nip that infection in the butt as soon as we can. Recorded, so it can be posted later. So all your pretty faces will be included. Sorry, I heard my own voice.
Yeah.
You were trying to get the link.
I know. I was like, what is happening?
I was
But,
getting the link for it right now. Sorry.
So, but Barry, if you do get sick and you have symptoms, the reason why you have that action plan is we don't want the infection to get any worse, because the longer an infection can happen, the worse the inflammation and injury to your tissues, and then the longer it takes to recover. So if we could stop it in its tracks, then we can limit the amount of harm that happens. And so the prednisone helps with the inflammation, and then you should have a prescription for antibiotics to help limit that infection. So that's your backup.
Thank you.
You're welcome.
And Barry, I just sent I posted a link in the chat for that webinar if you want to kind of skim through it and take a listen again.
Thank you.
Thank you.
And I just noticed there was an update on how long to wait for your booster dose after you've had COVID. It's actually changed because they change every day. It's changed between 3 and 6 months. So it'll be, you can get your booster dose 3 months after
An infection.
after you've had symptoms. So
Okay.
from the time you've tested positive, 3 months, and you're able to get your booster dose. Mhm.
Wonderful.
And I'm sure
Perfect.
that recommendation will change again.
Yes,
Literally 2
I'm
days
right.
after.
I am correct at this time at 2:56. October 19th.
Is a wee bit sassy. All right. I think we will end it there. I want to say thank you so much for everybody for attending.
Thank
Just
you.
a reminder, next month, I believe it's the 24th. I'm waiting for Alexa to give me a head nod. November
It's November 23rd. It's a Wednesday.
3rd.
Yeah.
We'll
And
be there next.
Yeah, it's with Kira. She's going to be one of our dietitians that are going to talk on nutrition for COPD and asthma.
Wonderful.
All right.
Thanks, everybody. Happy
Thanks for
belated
having me.
Thanksgiving.
Thank you.